computer. So while he's on the phone getting him, let me get the agenda. So both Wycliffe and Neville are from the Ministry of Health. For Bill's information, I don't know if you know that. And they have been really, really helpful on our projects. And they're the local Ministry of Health representatives in Kibera. So that is terrific. And we have a lot of things to go over. Let's see. Yeah, so he's on the call. So we have the three big topics today, and anything else that you want to bring up, just bring it up when we get to the point where we're ready to finish with the first three topics. Okay, Wycliffe is still on mute, so he must be calling him. Just so everybody else knows, Christian and I are going to Nairobi in early June to work with all the Abdul and all the folks there. So we have a little over a month to prepare. Christian, do you know what dates you're going to be able to go now?
June the 9th.
Oh, somebody has some noise.
Yeah, I think it's Abdul. I think we should all mute ourselves unless we're speaking because there's a lot of static.
A lot of static. Okay, perfect. Perfect. Thank you. So Wycliffe, not Wycliffe, Christian.
Yes.
Do you know when you're going to be able to go?
June the 9th.
Pardon me?
June the 9th. The 9th.
Oh, the 9th. Okay. Is that a travel day or arrival day?
Travel day.
Okay. So you'll get there on the 10th, probably. Okay, good. And I'll be there from the 3rd. So, and then I'll be there while you're there. And then when do you leave?
17th.
17th?
Yes.
Okay, leave. Good. And I leave on, I think, the 18th. Okay, perfect. Thank you. Okay. Wycliffe, are you back?
Yeah, I'm very much here. I'm trying to be on mute so that I don't cause unnecessary noise pollution.
Oh, and here's Neville. Wait a minute. Let me let him in.
Okay, kindly.
Perfect, perfect. So everybody will stay on mute unless you're talking, if that's good. So let's see. Did Neville get in? Neville, good morning. You could unmute yourself. Neville. Well, he's on mute, but hopefully.
Hello.
Hi, good morning. Welcome.
Thank you.
Yes. So we'll make a quick introduction. Wycliffe and Neville are both from the Ministry of Health that covers Kibera, or at least Neville is a consultant that works including in Kibera. And they're going to be part of our meeting today. And the first part will definitely involve Neville. And Neville, you can stay as long as you want, but after we talk about the data collection, feel free to leave or stay. We really appreciate your joining us and helping us. And of course, with Wycliffe as well, your partnership is just essential to our success in Kibera. And with Abdul, we really appreciate this. And so Neville, so you know, not that everyone will go around and introduce, because I think it'll just take too much time. Abdul, he founded and is running the Whale Kibera community organization, and it started off as a soccer platform. And now with both myself and Elliot and Bill, we became advisors. And during the COVID, we realized we couldn't play, the guys couldn't play soccer. So we started doing some health training, first aid, sex education, with outside resources. We also trained 25 community health workers in 2021, knowing that we were going to sort of pivot in terms of adding the healthcare part to WWK, because I think we all realized that the community health workers were not getting paid. And we misunderstood that in the beginning. So we thought, well, we can't train all these people and have them not be able to make a livelihood. And so that we said we have to help people become self-employed or hired or work on contract in order to have a better life. So, you know, even though the soccer is so important, it's really the beginning. And then, so we have access to over 2,000 players through Abdul's relationship with the coaches throughout Kibera. And we said, well, you know, let's come up with a model that we can help those residents who are trained to and having ambition to have some way of becoming employable, either self-employed, like I said, or contracts or hired. And so we thought the only way we can do this is have public-private partnerships. So the public, of course, is the Ministry of Health, and the private are private businesses in Nairobi. My background is mostly private, but some nonprofit. I'm a business coach for the last 30 years. And so I'm just, you know, taking the model for other populations into Kibera. Elliot is a public health expert and many, many, many years of experience in the US. And so what he helped develop in the US years ago is now being applicable for places like Kenya. So he has brought in a wonderful interns from the local universities who are studying public health and are helping us with the data collection, with all the ideas. So Elliot is really our in-house expert. Christian is one of the experts, interns and an expert. He's a pharmaceutical candidate for his doctorate in the United States.
He already has his doctorate.
He's a candidate for his master's because he wants to be more hands-on and in the field. He comes with a huge amount of experience. He's also African born and raised. I believe he's from Cameroon. Is that right, Christian? I think he's from Cameroon.
Yes,
anyway,
yes, that's right.
Good. And so he's coming with me in June for, I'm going to be there 2 weeks. He'll be there a week to implement some of the programs we're going to talk about today. He has a wealth of experience. He also has some questions for the two of you to see if he's going to be able to accomplish some of the things he wants to accomplish. So I think that gives an overview. Our goal is to bring better health services, better health knowledge in Kibera, and develop some models where we can help people there become employable or hireable or have some type of careers, especially in the health area. So I think that's enough because it's 8:12 or it's 12 minutes after the hour and we have a lot to go over. So do you have questions, Wycliffe or Neville, or can we start? I guess they're on mute. So assuming.
Nancy?
Yes?
Yeah, so I think I didn't get the last bit or the request. What did you say last?
Oh, we're going to now go into our 3 topics with you.
Yes, yes, that I got.
Good. And did you get a chance to read those 3 topics? Because the first one is the most important one. It's the data collection.
Yes, that one I got, and I think we had a meeting with Abdul, and I had already provided some feedback. I tried to share this in readiness for this meeting with Neville, but I think it was protected, so Neville could not receive it. So in
Oh,
good time, yeah.
okay. Okay, it shouldn't have been protected, but I don't know. We'll
Shared
definitely,
it with him.
yeah.
I shared it.
Oh, good. Thank you. Thank you. Amina is on the ball here.
Yeah, thanks, Amina.
Yeah, Amina has developed the database for us and has been very instrumental in getting this whole data collection program going. So, you know, she's been just terrific. So thank you, Amina. And so I guess we should get right into this. We've never done a data collection, and Abdul hasn't either, except a very, very elementary one. And what we want to do is make sure that we have the resources and the right, plan to go forward. So it's really valuable to the Ministry of Health and it's actionable. And so before we get into the logistics, is there anything, Wycliffe and Neville, that you can help us with, and what we should be thinking about, what's critical, how you could help us, what our steps should be?
So for me, I think I can start off. Like I was mentioning earlier, we met with Abdul. One of the key things that we had agreed, and even if you reflect on the previous meeting, is that first of all, for us to be able to collect the data, we have to know the sample size. For us to know the sample size, we've of course got to do the mapping. So one of the ideas that I had suggested last time is basically to get these families, these soccer families, through the various soccer clubs that are registered with the YYO, and even those that are not registered, provided they operate in the area. And I know that Abdul was having a meeting later that day with them. So the first point of contact is to get the teams, the football teams, and then once we get the football teams, then we are able to do the mapping. We can map them. Then once we map them, we can say that approximately these are the number of families we are targeting. Let's say 2,000. With that sample size, then now we can be able to be sure that this is the number we are targeting. So we are going to categorize them per different villages and of course sub-villages.
Yes.
The other thing that I know that we are going to do is that once we agree on the tools, which are largely okay, I think from what I was able to see, the tools are okay. Say for some in terms of the order, because we need to have the demographic data first coming before some of the things, but also in terms of data collection, is important for us to know the person who is collecting data upfront before we come to the end of it. Once that has been done, then we can be able to pretest this tool. So pretesting this tool, my suggestion was that we basically visit, let's say 30, we administer 30 questionnaires. We have 10 enumerators. Each of these 10 enumerators maybe are able to visit 3 households each. So that will give us 30 questionnaires. So with the 30 questionnaires, we'll be able to, for example, look at consistency in terms of the questions that are being asked, whether the questions make sense, and also the turnaround time. That is the average time taken for each questionnaire or for each respondent to be able to answer all the questions. So with that in mind, then that will determine the number of days we are going to work. It will also determine the number of research assistants or enumerators that we are going to bring on board. Of course, with the research assistants, we also know that they need to have guides. So tentatively, the guides should be the football or the coaches or the guides from the football teams, because they're the ones who know exactly where these families are.
Yes.
Then for the other thing, I would say that Neville and I have been able to carry out a lot of data collection in Kibra, in Langata. So we've done so many studies. So that should not be a challenge. And with the experience we have, we can be able to help out the team. It is also important to note that from the inception, we are going to have a training. So we are going to train. We are going to have 2 types of training. The first training is going to be, we are going to target the supervisors. So we must identify those who are going to supervise, those who are collecting the data. Then once we train them, then we have the supervisors training those who are going to collect the data. This is important because the supervisors need to know and appreciate this questionnaire for
Yes.
them to be able to troubleshoot, because sometimes those who are collecting data on the field will be having questions. So if they are not well grounded on the questionnaire, then they are not going to support much in terms of troubleshooting the challenges these people are going through. So essentially for me, I think that is an overview of what is expected. But I also know that this particular data, we can use ODK. I think that is why Neville is in this call, because he can be able to help us come up with an ODK tool that will be able to have this data. So they can work jointly with Aminata. That is if the team feels that is okay, so that some of the issues they can be able to work as a team and ensure that this tool is ready for data collection. So I think with that, I can leave it to maybe Neville if there's something he needs to say, or even other team members for who have other opinions to
Neville?
contribute. Thank you. And over,
Yeah.
Nancy.
Yeah, thank you so much. That makes it so clear. Thank you. So Neville?
Thank you, Wycliffe, Nancy,
Yes.
and also Aminata for sharing the document.
No problem.
But I'm just going through the spreadsheet right now, and I'm saying it's okay. The tool is okay. Just as Wycliffe has said, I specialized in the ODK data collection tool. So if that will be necessary, I'm ready to give my input and to support in the data collection.
Good. And what is that tool? Can you describe it?
No,
And
that's the one that Amina did together and sent it, and it was looked at, and Wycliffe looked at it, wrote back, if I remember, he said, "This is fabulous." So that's the tool.
but the tool, I think, I was thinking of the tool as a data collection tool. Is there a tool to use a electronic or an app to collect the data, or is it going to be all paper and pencil? Neville, you know,
the tool I'm talking about will be electronic.
yes.
Yes.
Why don't you describe that? Because that's what we're not familiar with.
Okay. It's I'll just convert the Excel form that has been shared into a form that there's an application called ODK, Open Data Kit. That
What is it? I'm sorry, what is it?
There's an application
Yes.
that can be found in the Play Store. It's called Open Data Kit Collect, or ODK Collect.
Oh, can you spell that?
ODK.
O
D.
Oh,
D for
B
dog.
K.
ODK.
Thank you.
Yes. So we need to create a form so that you can use that application. Then all the results that are collected will be, we'll find a way to channel it to a Google Sheet where we can retrieve it after the data collection.
Fabulous. Now, what does it require? Do you think our coaches and the collectors are going to have a phone that's strong enough to collect this, or will they have to do it on paper first?
It just requires a smartphone. And
Okay,
when you're collecting the data, you don't have to put the internet access or the data on. You can collect offline, then the time you're sending the data, you connect.
I see. Okay,
Yes.
so can you give a small training to Abdul and a few of his people, so they can see if they can do it, if they have questions?
Yes, I can.
Nancy, if I may just come in.
Yeah, sure.
Yeah, once we have this data, because normally this is now what these applications is what we normally use in terms of collecting data, because it has checks. One of the key things that probably would be looking to have is the geocodes or geolocation. So it would also be able to help us capture the exact location of these households. And also that helps us in terms of looking at the quality, because someone might just sit somewhere under a tree and then fill in something. So it's important for us to have this kind of checks and controls. That's why we were suggesting if we can have the electronic application, so that once it has been developed, it's a very easy tool, because it's just like it would be on paper, because you just swipe, then it gives you each of the indicators you are looking for. So once the complete, then you send it. So once it is sent, then you can receive it at the back end of and Nevila said you can download it as Excel, but this will help us in terms of, for example, looking at avoiding issues of data entry. It's not complicated. It does not require specialized kind of training. It just requires someone to have a basic phone, someone to have data bundles, that is when they are sending the information, and any person who is qualified to work as a research assistant or an enumerator for that matter should be able to easily use this particular application without having to strain.
Good. Oh, fabulous. That is a real important help.
Sorry, I forgot. Even today, as we speak, our CHVs, when we are collecting household data, you remember I'd shared the a register called MOH 513 household register. We convert this into an electronic form whereby the CHVs are able to collect data. So if the CHVs are able to use this kind of application, then it should not be difficult for people that we anticipate to engage in this exercise.
Great. Well, then, Abdul, I know you're on mute, which is fine. You'll have to circle back with Wycliffe and Neville, and organize whoever you're going to use to be trained in that. How many people would be doing this? Would it just be the supervisors, or would it be all the collectors of information, the one-on-one family people?
We will need this for the supervisors. I think the supervisors should be able to access this and should have maybe superior controls, and then we also have the enumerators, those who are collecting the data. So all of them can have this information. As far as the number is concerned, that should be determined by the quantity of work that we are going to do.
Yes.
That is the sample size for that matter, and also the number of days that we are going to work, as well as the average time for us to complete each of the questionnaire. So I think these are some of the questions in terms of the numbers that we might not have upfront. But the first thing that we need to know is the sample size. We need to know how many are there. So from the very word go, we need to map just to know that what numbers are we working with. Then now the numbers we are working with will inform us how many we need and the number of days that we are going to work.
Okay, so we'll need your guidance on the sample size that we should be shooting for. And, you know, I'm sure Abdul will be able to just get started as soon as you're able to work with him and you know, start getting the sample size done. Because that's great, because we want to make sure that we're doing it properly and that it's good data. So thank you. Thank you. I think that takes care of that. So what we'll do is, you know, Abdul will follow up with you and Neville and could you, you know, do you have any idea when they could start with the sample size? I guess we need the training too. What would be the next step weekly? Wycliffe, what would be the next step?
Nancy,
Yes.
I at some point you had asked Abdul to say something. I don't know whether he could have commented first or you decided that it goes at the tail end. Because for me, I think the steps are clear. You mentioned that we can work with Abdul on this. We are ready, and Abdul is already aware about this. So even as soon as we can agree on the time, and both of us, me, Abdul, and of course Neville, we can have a sit-in. But also, most importantly, because Aminata played a key role in coming up with this tool. So we need Neville and Aminata also to be able to work together to agree and to also ensure that whatever is captured in this Excel format is converted into the Open Data Kit collect platform.
Okay, good. Good. Now, one of the questions I have, my question is this: will you be able to provide that training from the government, or do we have to hire somebody to do that?
No, this training will be done between me, Neville, and probably Aminata if she can join in, even if it is virtually. Yeah.
Good. Oh, thank you. That's fabulous. And good. Well, that makes sense. Those were my questions because, yeah, obviously we don't know how long it's going to take until the sample is done. And Abdul has the coaches all set. And so I guess we're ready to go. Does anybody have any questions? Anybody on the call?
Yes, this is Amina. Thank you all for the feedback. One question I have is, I guess, should I just reach out to you all to like schedule a time for us three to meet to kind of figure out when we want to go through with the process?
That's fine by me.
Sure.
Okay.
It's
Okay,
also
great.
fine by me.
Good. Oh, thank you. Yeah, Amina has done so much work on this and I mean, without her doing this, we would be not where we are today. So she's excellent. So you'll enjoy working with her. Unfortunately, she's not coming with us in June, but maybe next year.
Yes, hopefully.
Wouldn't that be great? Yeah. No, she's
Yeah.
done such good work. It makes such a difference. So, okay, so I think we've covered that. Now then, oh, we're halfway through, so this is perfect. So the next topic revolves around Christian's two projects that he wants to accomplish between now and when we were there in Nairobi in June. And of course, we'll meet both of you. I keep saying Wycliffe and Neville. I'm sorry, I'm an American pronouncing your names. Wycliffe and Neville will meet with you as soon as I arrive and Christian arrives. And we'll let you know our date when we're there. But the two topics around Christian's and Elliot's projects. So Elliot, do you want to describe the two projects?
Sure. What I'd like to say is, let me put on my video maybe, if I can. If not,
Yes,
you
that's
can hear
good.
me anyway, right?
We see you, except only your nose and your forehead. So
I don't
yes,
know.
yay.
I can't see myself, so what do I know?
Okay.
Anyway, there's two,
Nancy, did you have to mention their forehead?
I'm sorry, what?
well, you can see that I'm old anyway.
But he's
The,
very knowledgeable. I'm telling you, you're glad he's old because he's done everything.
So we've got two things that I'm working with Christian, and Amina's helping us as well. She's, as you can see, terrific on some of the data management things. Christian is too. The first one that I'll mention is that he's going to look to do a pilot project that we will call chronic and medication management. And I've had a lot of experience over the years putting together some software packages that include things like that. And what we're looking to do, and have just begun to put together something that would be a data collection one, and to try to get it a pilot, maybe for a few hundred of the maybe the soccer families, the football families, as you call them, and maybe a second one that would have people who down the road would be up for paying for it. But what we are targeting at the moment is to have a draft of it that we can send to everybody who's on this call within 2 weeks and get feedback, just like we did on the data collection one, where Amina put together, ran it by our people, and then you all got a chance to look at it. And I'm glad you now feel that it's totally acceptable to go ahead on that project. We want to do the same kind of thing with the medication management. Christian has, he's a doctor of pharmacy, and he also is a specialist in public health. And he has done this for numerous hospitals and knows more about medication management. He would be considered a major expert here in the United States. And I know that once the things get started, a program like M-Pharma, which is interested in partnering with WWK and you all at the Ministry of Health, it would be a very helpful project. We will have a pilot of that in about 2 weeks. And the big thing I've noticed in the past, Wycliffe, you've mentioned chronic illnesses, you've mentioned tuberculosis, diabetes. We're going to focus on 4 or 5 chronic activities, hypertension, so at least those 3, and be able to collect from individuals, which would then be part of a family, to get all those people in the pilot. Let's say we do it for 200. We would look at the pilot and say, how many of these family people who filled it out have high blood pressure, hypertension? And one of the things, I'll mention it as part of the health field later, would be just to check people's blood pressure. And if it's high and all, they would then be included in a cohort of people who are listed as either pre-hypertensives or actual hypertensives. And if people know that they have diabetes and all, we would get a list of all of the medications, the actual drugs that they're taking, and over-the-counter drugs that they're taking. So at this point, this is a interim report to let you know that in about 2 weeks, we'll have a document, a database document to show you all. And with the idea that when Christian gets there, second week in June, what we would love to do is have a planning meeting before that where he can figure out with you all, hopefully maybe at a facility of the Ministry of Health or somewhere else, where let's say 200 people, 200 families, whatever could be put together, would create a database on these 3 or 4 chronic illnesses and the medication that the people are getting. And that's going to be a very important one going forward, where I gather that there's all kinds of pharmacies that are not certified, that the pharmacists are not really pharmacists, where we'll try to turn it into something where it will be people who are very appropriate in treating. But the first thing would be that they'd be able to start getting medication that's real and applicable for the kind of diseases we're talking about. And the other thing that can happen for this pilot project, which is part of this initial database that we just talked about, is one of the questions is, has somebody gotten 1, 2, 3 COVID jabs or none? And we can start looking at that with you to see if it makes sense to start figuring out how to get people COVID shots, assuming that there's the appropriate funding for it. So I'll stop there and say that's the first one on the medication management. And the second one is Christian is absolutely looking forward to setting up a health fair. And that's where we would hope that you've had some experience doing that. He's had experience, we've done that before. And one of the key things that might work would be to combine it with something, and that's where, we haven't talked to Abdul about it yet, where it could be combined with a little football soccer festival where some teams would come out, and there would be potential sponsors who would want to advertise the kind of things that they're doing, and at the same time collecting information from the people who show up at the health fairs. So I'm going to stop at that point, see if you, Christian, want to add something, and then get feedback from you all on what you think is potential applicable, can be done when he Christian is there in June.
Hi, Professor Elliott. I think you say almost everything. One thing I want to add from the pilot project we want to start in Kibera is that one way we can use it will be, let's say we found out in the pilot program that some people or some families have 3 or 4 chronic diseases, meaning that they are what we call here in the U.S. immunocompromised. That can be a good candidate to get something like the COVID shot. If we don't have enough funds, we can start by targeting them. If the Ministry of Health doesn't have that much money, targeting them small program to give them and those organizations that they really need to protect their lives. That's another way we can use this type of data going forward. And also, what we want to achieve during the health fair, we really want to work with the Ministry of Health in terms of them providing us some human resources, because they have some level 2 or 3 health facility. We can use the staff like nurses or doctors who want to volunteer during those health fairs. We can have many stations, like one for blood pressure, one for diabetes testing, one for sexual education, one for and tobacco smoking station. We can have many stations, and they have to be filled by those volunteers. And we also have, I think Elliot mentioned it sometimes early on, people from UPS who want to volunteer to help staffing and helping us during the health fair. And we can also reach out to some private entities like Pharma to see how they can help us to organize those health fairs. So, but before going further into the detail, we want to know if you have some need, some health need for that community, for the Kibera community that we can start working on. I don't know if you are planning something like a clinic for some folks in Kibera, we can incorporate that into the health fair. I don't know. That's my question.
Everybody's on mute. Wycliffe, you're on mute. You might be the best person to answer Christian's question.
Nancy,
Yes,
I think one of the challenges, I don't even know whether you guys are able to see me.
yes,
One of
we
the
can.
challenges I have is that I'm on the road, and this place sometimes there's no network coverage. I heard when Elliot was doing the presentation, but I didn't capture the question that was being asked by
Christian.
So kindly, if you could just replace that so that I get to understand. I'm also driving as well.
Yeah, you're smiling though too. Christian, do you want to just, I'm trying to think if it'd be quicker if I could just recap. Christian, do you want me to just recap about the health fair?
Yes, please.
Okay, so Christian's big, project that he'd like to initiate, especially when he's in Nairobi, is to have a health fair in Kibera. But it would not just be booths and, it would include, probably surround maybe a soccer league, playing. We need sponsors and volunteers. So there'll be doctors, nurses set up to take blood pressure, free, of course, and other preventative diseases that they could get tested for at the fair. There'll be booths set up. So we'd have nurses, we have doctors, we've had sponsors, maybe Pharma, UPS. They have people who want to volunteer. And his question is, are you planning anything like this at this time? And do you have experience in health fairs that are pretty complete, very interactive, and hopefully a lot of people would show up?
So, okay, thank you for that elaboration. So basically, one, we have been able to do outreach programs, health programs, that is targeting various groups. And normally these are done through various organizations or a specific organization coming together, including even vaccination for COVID-19. So basically, this is something that can be done. One of the key things we need to do is just to do adequate preparation. So we need to determine what exactly do we need to do at the fair. And then now with that, we can be able to map those stakeholders that are interested in this particular area. Then we'll be able, like for example, if you're talking about NCDs, we can look at issues of screening for high blood pressure. We can look at probably screening for glucose levels. And also we can also have a forum whereby we educate community members in terms of what are how they can be able to prevent some of these conditions. So this is something that we can very much organize, and what we need is just to be clear on what is required. So probably if I have a document to work with, and also to be able to do the mapping for the stakeholders that we work with, also to get the authority from the director Yeah, so those are that is something like I can do. And in terms of mobilization for the community to participate, yeah, so this is something we can work closely with Abdul and the team, but also within the structure of community health, we can mobilize through our CHBs so that this becomes a success. So if it is, for example, a football event, we'll be able to screen, we'll be able to give health education, we'll be able to do so many interventions that that we feel that would be relevant for the theme of this particular fair. Yeah, so that is my response.
Okay, so it sounds like if Christian can communicate with you directly and Abdul to outline some of his ideas, that could be very helpful to you. You can get back to him and start moving forward on planning, because it's not that far away. It's about 6 weeks away. And to get sponsors, it's, you know, everything has to start soon. So Christian, if you can get to Wycliffe, you know, your plan that you would like to envision happening to him, he can get back to you, it sounds like, right away.
Yes, exactly.
Okay,
exactly.
sounds good. Sounds good. I will.
Also, Christian had some questions for you. Wycliffe, you're probably the best person to answer. Is he going to be able to do any of these, you know, testings and pharmaceutical things without any kind of official permission?
With regards to testing, you might because all drugs or medicines, and even some of the equipment, normally they get authorization from the Pharmacy and Poisons Board. So probably again, once this, I mean, for me, I think what I need to know is I need to know all the specifics of what need to be done. Then I channel them to the appropriate organs. Then with that, we can have an informed feedback in as far as what is needed to be done and how long or how soon can that be done. So if I have the specifics, then I'll channel that appropriately. We have okay, personally I have the goodwill of the director, so anything that would require authorization of the director, I can be certain that I can get in good time, provided I have this information. Like if I have this information by next week, I can kickstart the process of doing what I need to do to get what we want done.
Thank you. Excellent.
Yeah,
Excellent.
that sounds good. I have a question. Are you able to, because one of the things that might add a whole lot of interest would be able to provide COVID shots at a thing like a health fair? Is that possible?
Yes, that is possible. That is possible because I think the government policy is to do vaccination, and I'm privileged to attend a meeting. We are doing a communication strategy this week because we've noticed that the uptake of COVID-19 vaccination has gone down. So from yesterday, today through to tomorrow, we are doing that communication strategy. So we are, and as a government for Nairobi County, we have a target of achieving 70% of our population to be vaccinated against COVID-19. So these are efforts that are actually going towards supporting government strategies. So this one you'll get, we can be able to get authorization, and we can be able to support.
Great.
Sounds good.
Sounds good. Christian, do you have any more questions?
No, I will reach out to, I think, Professor Siegel and we're going to reach out to Mr. Wycliffe to get down to the details.
Okay,
very,
good.
very shortly.
Fabulous. Good. Elliot, anything else at this point?
I think that we've covered a whole lot, and we've put a whole lot of activities and work onto Wycliffe and Neville, and I hope you feel that we're not imposing too much, but I think that there's terrific opportunities of things that could come out. And as we were talking, that's why I thought about COVID. If we get that data set that, is going to be moving along and get, let's say, most of the 2,000 families, we will already know how many of them have not gotten any COVID shots. We could then have the coaches put out information to their players and their parents saying, come to this health fair, you'll be able to get a free COVID shot.
Yes.
And that might be an enormous big push that would help, certainly you, Abdul, with providing something to the teams and your players.
Excellent. Excellent.
I think, Nancy, this is fabulous. I think I'd use that term again. And I must really appreciate the work that has been done by Elliot, by Christine. They've done a marvelous job. And I can assure you of our support, especially, I remember asking Abdul, like some of the indicators, I know this was done mostly by Aminata, but I was asking Abdul, what is the rationale, for example, for COVID-19 status? And then I'm really feeling good about the kind of feedback that is being provided, because now one of the key things is that if we realize some of these people are not being vaccinated, then we can ensure we do the mobilization. So I must really thank the team for the work that you guys are doing over there. And this makes us sometimes feel like even if you assign us several or various tasks and responsibilities to do, then we feel that it's a privilege to even get this kind of opportunity. So we will be able to support that. Should not be worried.
Oh, thank you. Well,
yeah,
it's a team approach. And if we don't have your input and your partnership, we would never be able to do anything. And so we really appreciate our partnership with you. It makes all the difference. It makes all the difference. It just makes us feel like, wow, we can really make maybe a difference. And, and that's what we want to do. And we're enjoying this. I mean, we have a great leader in Abdul. When I first met him 5 years ago, I was just so impressed with him. What he did was so little, and his enthusiasm and can-do attitude. He's so smart. And you always want to back good people, because that's what gets done, things done. And he's one of the best leaders I've ever worked with. And I've worked with a lot of people over my life, business leaders. And so I thought this is an opportunity. And so it gives us all inspiration and, gratitude to be able to find people like you, Wycliffe, as well as Abdul and Neville. And, it just takes a team. So you're part of our team now, and we really appreciate it. So
thank you for the compliments.
Yes, well, it's good work. So that's what we're here for. And we're enjoying the challenge. So if anybody has anything else, otherwise we can sign off till the next time, which will be in a couple of weeks, I guess, with, some more updates from Elliot and Christian. Maybe we can pull another meeting together again.
Well, have a good weekend.
Thank you, Bill. Yeah, one of our advisors, Bill, is on here. He's been quiet, but he's working behind the scenes. He got us the introduction to UPS International. So hopefully we can get some volunteers to work with us, with all of us in Kibera. So anyway, everybody, thank you.
Thank you.
Thank you.
Thank
Take
you.
care.
Okay,
Bye.
take care. We'll see you soon.